ungloved hand. Now, having sterile gloves in place, adjust them so they fit comfortably. With sterile gloves on, it is safe to touch anything on the sterile field. Remove the catheter from the sterile wrapper, placing it on the sterile field and discarding the wrapper. With respect to the catheter, local hospital policy, as well as the recommendation of the supplier, is to check the patency of the catheter balloon by inflating it using the pre-filled syringe from the tray. If the balloon inflates, make sure it will also deflate. When this is done successfully, put the syringe to the side. Note that 2 urologists consulted on this procedure do not consider this step necessary, given the quality of currently supplied Foley catheters. They also note that it could potentially cause problems when the balloon does not collapse entirely and bunches around the end of the catheter, creating problems when inserting. Please follow the policy and practice of your own institution. Open the water-soluble lubricant. Lubricate the tip of the catheter approximately 2 centimeters down from the tip. Open the povidone iodine. Take the cotton swabs out of the container on the tray and pour the iodine into the container. The catheter tray is now completely set up. There are 2 drapes on the tray. The first one is a plain square drape, which has a dull side and a shiny side indicating it is waterproof. Unfold the drape, remembering not to shake it open. Slide the drape, waterproof side down, in between the legs of your patient, creating a sterile field. The second drape is a fenestrated drape, with the opening in the middle. It also has openings on the sides. Again, unfold the drape, don't shake. Use this drape to cover the pubic area so the opening allows you to expose the perineal area. Place the urine receptacle on the sterile drape between the patient's legs. The next step is to clean around the urethral opening before the Foley catheter is inserted. Gently separate the labia majora and minora with your non-dominant hand, exposing the urethra and vaginal orifice. Your non-dominant hand is no longer sterile and cannot return to your sterile tray or equipment. Using your sterile hand, cleanse the genitalia 3 times with the povidone iodine. Do this with 3 separate swabs, each making a single pass from front to back. Discard each swab away from your sterile field. Grasp the catheter in your sterile hand. Hold it about 2 centimeters from the tip, and if you wish, coil the rest in your hand. Ask the patient to take some slow, deep breaths in and out. Gently insert the Foley catheter into the urethra. Continue to insert the catheter all the way to the flange or flared tip, collecting any urine in the sterile container. If resistance or pain is felt, stop, then gently try again. Inflate the balloon with the sterile water from the pre-filled syringe in the amount indicated on the catheter port. Do not use saline as it may crystallize over time, making it impossible to deflate the balloon when the catheter is removed. Gently pull back the catheter until resistance is felt, indicating the catheter is abutting the bladder neck. Urine should now flow freely through the catheter. Remove the protective cap from the drainage bag tubing. Connect the catheter to the drainage bag and remove the tray and drape from the bed. Dispose of these items appropriately. Using a cloth, wash the povidone iodine solution from the perineal area. Take your gloves off and then, using a piece of tape, secure the catheter to the patient's inner thigh. Cover the patient so she is warm and comfortable. Mrs. Foley, you should feel more comfortable now. Do you have any questions? No? Okay, I'll be back to see you in a little while. To remove the catheter, you will need an appropriately sized syringe, an incontinent pad in which to wrap up the catheter, and non-sterile gloves. Remember to leave the catheter connected to the drainage bag before you remove it, but remove the tape. Place the incontinent pad on the bed between the patient's legs. Put on your non-sterile gloves. Attach the syringe into the catheter port. Draw back gently until the amount of sterile water indicated on the catheter port has been removed. Tell the patient you are ready to remove the catheter. Use a gentle continuous pull to remove the catheter. Dispose of all contents appropriately.